welcome. This is TMJ course 102. We'll call it myofacial pain. Myo meaning muscle, facial meaning the face or the the facial area. So it means pain of the face. That could include headache, neck pain. A lot of times people have problems behind the sinuses, around the eyes, around the teeth, and some of it all can come from the occlusion. It certainly could come from the teeth themselves, but if the occlusion or the bite is off, that can lead to all kinds of issues. So we're going to talk about what that is, but we're going to recap just briefly that this is a normal position and actually the ideal position. The teeth are all interdigitating appropriately. If you look at the little dot again, it lines up with the center of the jaw joint, and we're on the disc, and these muscles would all be being relaxed. So we're going to change our little insert, and we're going to put in a different insert, and that gives us the we will change the jaw position. If the teeth are different, it's going to change the jaw position. So notice what happens now. In order for our teeth to touch, these little points no longer balance out. They no longer approximate each other. So you can see that the jaw has been driven backward, and we see this a lot in an awful lot of patients, and it will actually impinge on the tissue back here. And like I said, the muscles will have to pull on this jaw joint to torque it around so that the jaw joint itself, the teeth themselves will always win out over the muscles and over the jaw joint. So by having this driven backwards like this, this will often impinge upon the ears. So there's a good test you can do. You can take your little pinky, and stick it in your ears just like this, and bite down. And if you can bite down and you can actually feel your joints impinging on your ears, you may have a posteriorized jaw joint that could be leading to some of your issues. However, that would have to be, certainly checked out by a competent dentist. So if this is in the wrong position, then that can cause all kinds of pain and problems. It can not only in the ear, but also headaches, like I said, sinuses, neck pain. It could even cause back pain by having these teeth being in the wrong position. So the next step is, well, first of all, this isn't balanced, so we need to bring it back into harmony, back into balance. So what we'll do initially is put in some kind of a little bite splint. This will probably look like a plastic horseshoe. There's all kinds of other designs, but basically what it's doing is it's taking the teeth out of the equation. It's allowing the jaw to float and the muscles to float back into where it wants to be. You can see now that the dots are lined up, and it also will allow these muscles all to relax. And if we can achieve that, then we know that we have a balanced situation, that the bite was causing the problem in the first place. Because if we hold the jaw in its ideal position and we start to close down, as you can see, it only touches in one spot. And that could be the reason that you have this disharmony. The teeth aren't lined up as you think they are, because the muscles, as I said, will torque the jaw to move it wherever it needs to be in order to make this happen. But this is really where the jaw and the entire body wants the jaw to be, so the teeth are kind of in the way. So what can we do about it? Well, there's a lot of choices. Orthodontics, equilibration, crown and bridge, changing the bite, but basically we have to do something to modify the occlusion, modify the bite, in order to bring this jaw joint and these muscles back into harmony. So this has been the myofacial pain sequence, TMJ 102, and if you will continue on with some of the other dysfunction in subsequent videos. Thank you for watching.